This hospital is a level 4 hospital, and it serves the larger, it's the main facility in Imenti South. So normally before the pre-COVID era, we would see around 300 patients in a day. We had quite a number of patients, and immediately when COVID came in, our patients reduced markedly. We would see less than 50 patients. Before COVID, we would see quite a number of patients living with essentially diabetes and hypertension. And I can see, like in the month of February, we saw a total of 126 patients. That is the ones who are booked for the clinic, though there are so many of them. But immediately COVID came, the number reduced to 47. That is the month of March. And then in April, it was 13. So you can see there was a drastic drop of the patients that are living with diabetes and hypertension.
The support group that we've been monitoring in our setup on the patients living with diabetes and hypertension, we had a very active support group that is affecting the age bracket of 40 to around 58, and upon this season of COVID, they were not able to come to the hospital and continue with the normal teachings that we provided to them.
After emergence of the COVID-19, people now are not coming for drugs. They are not attending their clinics. They are not coming to the hospital to seek treatment because of the fear that they may come and they mix with the people who have COVID, and then they die very fast because it is said people with other underlying conditions, they stand higher chances of becoming critically sick because of COVID-19.
In case there is a positive case of COVID, there would be an effect both to us as a hospital and also to the NCD clinic. There will be a negative impact. One, we are going to see maybe many people, staff, going for quarantine. And then two, there will be stigmatization, as in many will not want to come again to Kanyakine Sub-County Hospital. What we are there, we are prepared for that, because what we have done, we have different teams that are supposed to handle all this, and our hope is that in case we have a suspected person coming, we are hoping before they get to this side of interacting with everybody, they are going, the team that is there, there's the case management team, there's the quarantine isolation team, there are several teams. We are hoping that they are going to handle that case and they are referred to Meru level 5 before it's too late. Yeah.
But we are very grateful to have such a comprehensive care unit whereby now we'll be able to give them more attention. We'll be able to offer diverse services to these clients or these patients.
What we were able to do with the support of Red Cross, we started pairing our patients with this community health volunteers so that we can be able to follow them up. This came after a case that came to the hospital. The patient came when she was comatose, and our sugars were very high and we were not able to save that patient. And normally our sugars were controlled. But now she was found comatose, came here, but it was too late.
Hapa sasa kwanza imalizike, tunakuja kliniki hapo. Na hakuna mtangamano wa watu wengi kama vile tulikuwa huko tunatangamana na watu wote. Wale wanagonjeka magonjwa ingine. Sasa tunakuja hapa, tunasaidiwa hapa.
We are longing to have more partnership so that we can be able to reach where we want to reach, especially at time of COVID-19. If there is a time we need more partnership in handling these NCDs, it is now, because things have become very complicated. The way we were doing things before now, it's not the way we are doing them right now.